Next, I'm going to invite to the podium Dr. Florentina Berianu. Dr. Berianu is an assistant professor of medicine at the Division of Rheumatology at the Mayo Clinic, so she's one of our colleagues in the division. Dr. Berianu is developing an interest in a few different things, including inflammatory myopathies, and she's going to talk to us today about that topic. So, Dr. Berianu.
Hi, everyone. I'll talk about inflammatory myopathies. I have no disclosures. I'll discuss about the workup when you are dealing with a weak patient, how to recognize clinical and histological features in idiopathic inflammatory myopathies, and discuss different types of myopathies. This is an old classification criteria, but it's still commonly used, and we usually refer to polymyositis, dermatomyositis, either one of this in association with malignancy, either one of this in association with other connective tissue disease, and in dermatomyositis, we talk about children dermatomyositis. I would add to this classification criteria necrotizing autoimmune myopathies, which I will discuss, and obviously the sporadic inclusion body myositis. It's a rare disease. As you could see, the incidence is very rare. Dermatomyositis has a bimodal peak, children and adults. Polymyositis is very rarely seen in children less than 15-year-old. It's predominantly seen in female, and this difference between gender is more significant in those associated with other connective tissue disease. This disease in the United States is more common in African American than Caucasian, and in children, interestingly, the ratio is 1:1. This patient will present with weakness, and it happened insidiously, and it takes, even for the patient, it takes time to realize they are weak. Usually it's noticed by someone else around them. They notice that they have to use their hands to get up from a sitting regular chair. It involves usually the proximal muscle of the shoulder and hip girdle. They will have difficulties to performing tasks like climbing stairs and raising their arm, reaching shelves, combing their hair, and it can involve the extensor of the neck. And I've seen at least recently 2 patients coming and holding, it's terrible, holding their head.